name is Jermanee Bostic. Today I'm going to be informing you of nursing specialties. Did you know that nurses comprise 47% of all healthcare personnel? Or that for each MD, there's a nursing equivalent? Today I'm going to be teaching you about nursing midwives, nursing anesthesia, and nurse practitioners. First, let's talk about nurse midwives. Nurse midwives are one of the most important in the healthcare field, as they help women in pre, post, and during medical care. Nurse midwives requires a graduate level degree and training in excess of 1,500 hours. They also help fill the ever-present void left by the strenuous educational requirements of a traditional OB/GYN doctor. 86% of patients, according to the administration of nurse midwives, say they feel confident in the care of a nurse midwife. Why do you care about this? For all of the women in the audience, if you're ever pregnant and need pregnancy care, when you go to a hospital, there's a good chance that a nurse midwife will be taking care of you. Now that we talked about nurse midwives, let's talk about nurse anesthetists, or CRNAs. Anesthesia is a critical part of any healthcare scenario. When nurses administer it, it's called nursing practice. When doctors administer it, it's called medicine. CRNAs receive extensive training in administering anesthesia and the body's general physiology. CRNAs help fill the ever-present void also left by doctor strenuous requirements to become an anesthesiologist. It's traditionally a master's level degree, but according to the administration of nurse anesthetists, by 2025, all programs will be transitioned to a doctorate level degree. Why should you care about this? Because it will help bring the healthcare premium cost down due to the cost that it takes to employ nurse anesthetists versus general anesthesiologists. Now that we discussed nurse midwifery, let's discuss nurse practitioners. Nurse practitioners are the closest thing that you will get to a general MD in a healthcare setting. They are the only provider licensed to open their own primary care clinic and also practice without an on-site physician. According to the administration of nurse practitioners, 916 million Americans see a nurse practitioner every year. They also help lower the cost of healthcare premiums because instead of going to a large healthcare facility, you can go around the corner to a clinic to address less dire needs. Nurse practitioners fill the void left by every other type of provider, to include general MDs, physician's assistants, and specialty jobs. Today, I have told you about the nursing specialties to include nurse midwives, nurse anesthetists, and nurse practitioners. All in all, I know this may be a lot of information to take in, but if you remember nothing else, please remember that if you go to a healthcare setting for any type of problem or disease or injury, there's a 95% chance that you might come in contact with a nurse. I just want you to know that you're in very caring, competent, and well-trained hands. Thank you for your time.